Good evening, ladies and gentlemen. Thank you very much for joining us this Friday evening for our webinar on fertility treatments and COVID-19. And we're going to talk about your safety and resuming treatment in a manner that is safeguarding the health of all our patients and our staff. So I'd like to introduce this evening's panel. I'm sure they'll all be familiar faces to a lot of you. So first we will have Dr. Geetha Venkat, who's the director of the clinic, and then myself, and Ms. Rachael Close, who's our lead nurse, and Ms. Carina Nobrega, who's one of our patient coordinators. So tonight's agenda is starting with the impact of COVID-19 on fertility treatments in the UK. We thought it's good to sort of provide a bit of background. I'm sure a lot of you will be sort of keeping a close eye on how things have evolved, but we'll give you the story from our side. And then we're going to discuss how we plan to keep the clinic as COVID-free as possible. And then we will discuss how we're going to triage and test patients in order to try and minimize the risk of any infection at the clinic and to any of our patients and staff. And then we'll discuss the sort of practical aspects of patient care and how we're going to support all of our patients. And then lastly, we're going to discuss something we're calling the code of conduct, that we want everyone to really sort of do their part in this journey. So without further ado, I'd like to introduce Dr. Geetha Venkat, who's going to discuss the impact of COVID-19 on fertility treatments in the UK. Thank you very much.
Ladies and gentlemen, thank you very much for joining us this evening. Suddenly, out of the blue, we got an intimation from our regulator, Human Fertilization and Embryology Authority, with Direction 0014, which was issued on 23rd of March 2020, saying that all the fertility clinics in the UK should be closed and we should not commence any treatment. We were allowed to complete the patients who were going through the treatment at that time. We were not going to start any new treatment. And if some patients were pregnant, we were allowed to have the monitoring scan during pregnancy. Therefore, we had to make a big plan of what to do and how to do and inform all the patients. And obviously, all the patients were very anxious and they didn't know what to say, and they were worried what will happen to the treatment. And there are some patients who needed treatment quickly because of the very low AMH. And they were all phoning to say, when will you reopen and when will you allow me to start the treatment? At that stage, we didn't have any answer. We will inform them that we will let you know once we hear from our regulator. After this, of course, we closed the clinic and most of our staff were furloughed, except a couple of nurses, myself and the manager and patient coordinator. And when we were monitoring the patients who have had the treatment and pregnant from the treatment, we got intimation on 1st of May from our regulator, HFEA, saying that we will be able to apply to recommence the treatment for the patients. From 11th of May, we have to send an application form and the regulator will look into it and allow us to start the treatment, provided we have proper strategy and other precautions to minimize the risk of infection to the patients as well as to the staff. Now we have got the permission from the HFEA to start the treatment, and we are now calling and informing patients about the situation in our clinic, and we are preparing for the treatment, and we will be starting the first set of stimulation for the IVF treatment next week. The aim of this new guidelines, that is our protocols and everything, is to reduce the infection, reduce the risk of infection basically to the patients and the staff. And I think all of us will be getting used to this new normal now. Initially, when we were asked to stay at home and we had this lockdown introduced, we were all moaning about it. And we said, oh my God, well, how will I manage? I will miss everybody and I will get bored. But what happened? Everybody followed it and everybody's still saying, most of us, yes. And we had some pending work. Everybody tells me, whoever I spoke to me, said, oh, I've been wanting to do this for a long time and I never got around to it because I never had time. And then I sat down and did all those things. I feel good in myself. And similarly, so we get used to that. When we are now starting the treatment, we have to follow the new guidelines and all the patients and the staff, even if it is new for the staff, we have to get used to this new guidelines regarding the protection of the patients and the staff. And next thing is when we are going through the treatment, the question is, when the treatment here is not like any other medical treatment. Here we are doing IVF treatment. The aim is to make the patient pregnant. And when the patient gets pregnant, the risk is not only to the mother, and there is another, living there, that is the baby or the fetus to start with, and we have to protect that little one as well. That's why it is important that we minimize the risk to the patient and to the staff, because as the response, it is the responsibility of the management to protect the staff who are involved. So we have to protect them, and we must minimize the risk of infection being passed from the mother to the child or the baby, I should say. And the last but the least, because this is very important. Our regulator is concerned that NHS is already overwhelmed by the admissions to the NHS hospital. They have cancelled all the elective surgery, and there are a lot of waiting lists. Cancer patients are waiting for surgery. At this stage, they said that please don't send some more emergency patients with hyperstimulation. You must have heard of one of the important complications of IVF treatment is ovarian hyperstimulation syndrome. When women produce a lot of eggs and there is fluid collection in the tummy, they feel unwell. If it becomes severe, they have to be admitted to the hospital for monitoring and treatment. And if we send patients like this to the NHS hospital, it will be an additional burden for them. And another side of the story is if one gets pregnant, there is always the risk of ectopic pregnancy. Again, that is an emergency. We have to send the patient to the NHS hospital for treatment. Having said all these things, the government or the regulating body have not informed or instructed the general public not to try for a baby and not to get pregnant. Therefore, if some of them get pregnant, some may miscarry out of those natural pregnancy, and a few might have ectopic pregnancy in our clinic, but we must not create additional hyperstimulation syndrome and ectopic pregnancy. That is what we are interested in. So we are going to reduce the dose of the way we do the stimulation. We control the stimulation better, and that way we don't make anybody produce a huge number of eggs and carry the risk of ovarian hyperstimulation syndrome. For this reason, all the team, we sat together for many days and prepared the protocol. See, we had the protocol to protect against the COVID-19, that is one. And next protocol is the new management protocol of the patient during the IVF treatment, so that everything is controlled better. And in addition, we have to reduce the number of visits the patients are making to the clinic, because whenever they travel, there is a risk to the patient. So we make it under tight control, and we try to do consultations, concerns, and discussions over the video consultations or Zoom or Skype. Therefore, patients can see the doctor and the nurse ask questions, but they don't have to make the journey to the clinic. Okay, so if we sort of have an overview of all the treatments that are possible, we of course offer some simple treatments like ovulation induction, timed sexual intercourse, and to surrogacy and egg donation and everything. But we look at the main treatments. First of all, we start with IVF and ICSI. Now, generally, the trend is to proceed with the stimulation and freeze the embryos. That means we are dividing IVF into 2 stages. First stage is to create the embryos. Second stage is put the embryos back in. Here again, as I told you, initially when we drafted this protocol, we said that nobody will be allowed to have embryo transfer. I will come to the reasons in a minute, and we are going to freeze all. Generally, all the clinics have been recommending this freeze-all and frozen embryo transfer as a measure even before COVID. This is to increase the success rate, because we all now know that during the frozen embryo transfer, the embryos implant better. During the stimulation, the women have lots of eggs and the hormones are high, their tummy is bloated, they feel really unwell. And at this stage, if we transfer the embryo, the implantation is not so good as the frozen cycle, because by that time, everything has quietened down, calmed down in the abdomen, and the woman is in a better position health-wise to take the embryo in, or for the embryo to implant and the woman to get pregnant. That's what we did. But what we thought was, we do not know the effect of the COVID-19 on the fetus. Does it have any teratogenic effects? Can it cause any problem with the development of the baby? Now, for example, we all came to know that when we heard about this Zika infection, that is another viral infection, babies were born with small head, that is called microcephaly. And that's why we said that everybody must be tested. And if somebody is positive, don't do the treatment, because we don't want the babies to be affected. The aim of the IVF and all the patients' aim is to go home with a healthy baby. So we didn't want to interfere with that. That's why we tested and we didn't treat. But here, COVID-19 is a new thing. Nobody knows whether it's going to affect the babies. I mean, at the early stages, like at the embryo stage or fetal stage, when the organs are being developed. Therefore, we said that it is safer to freeze all the embryos, not transfer them. But with the COVID-19 is, I will say, weird and difficult virus, because every day it is changing. Every day, there are webinars, there are papers which says, one day it says, look, there is no problem. Another day, no, we don't know, we should not put the embryos. So now we have attended lots of webinars all over the world, and now people are saying that doesn't have any teratogenic effect, but still the numbers are very low. We can't say with 100% certainty. It is possible early stages, we think that it does not affect the fetus. It's not like Zika virus. And also, pregnant women are not the target for this virus. What I mean is they are not in the susceptible group or vulnerable group. And even if they get the COVID-19 infection, they don't have very severe illness just because they are pregnant. If they have other underlying conditions such as diabetes or asthma or something else, they might have severe illness. It is not because of the pregnancy status. So we know that, and there is no additional problem. Now, the next thing is, if the woman catches this infection during her pregnancy, is it going to be passed on to the baby? Because there is another living human being inside. So we have to protect that baby. So people have done studies, because there are a lot of women who developed COVID-19 infection during pregnancy, and they delivered babies in the last 2 months or 3 months. And people have followed them, done the research, and they found that infection is transferred or transmitted up to the placenta. They found the infection, the virus in the placenta, but it doesn't cross the membranes. And they checked the baby and the fluid and the amniotic membrane. They biopsied that. They found that there was no virus in those things. That means there is no vertical transmission. However, again, I can't say that that was a huge study. These are all few cases. We can't. But as far as we know, we can say that the babies are not affected directly from the mother. However, the babies may be affected after birth through, from outside the environment. that can still happen, but there is no vertical transmission from the mother. And because of this, we had another meeting. See, we start writing the protocol, and we are writing the protocol every day. We are changing it because the things are changing. So you, as patients, please don't get confused. We are not trying to confuse you. We want to do the best for you. Whenever the information is updated, we will also update the protocol. However, we will keep you informed. And I would like all the patients to think about that there is a choice here. We are not saying you must do the treatment now. If you don't want to do it because you are anxious and you are scared, your baby might be affected, don't do it. But how long will you wait? Nobody knows the answer to that question. So if you are okay with that, like, okay, it doesn't matter because we don't know, we don't want to wait for another 6 months or a year, I will take the risk and I will do the treatment. We can reassure you that there is no major problem, but it is up to you. You have a choice. And because of the changes we learned during the last few weeks, saying that babies are not affected directly, we said that, okay, in some cases, we might be willing to consider fresh transfer if that's what the couple want. And we are also thinking of starting some frozen embryo transfers once we are started with these fresh IVF cycles in the beginning, and then we might be able to commence it in the future. Again, we talk about egg freezing. We collect the eggs and freeze the eggs. There is no risk, except for ovarian hyperstimulation syndrome. What I told you earlier, that we will be extra careful during the stimulation. And IUI is what is called intrauterine insemination. Here, what we say is the risk of ectopic pregnancy is rather low, because if the tubes are open and healthy, only then we perform the intrauterine insemination. Otherwise, if the tubes are damaged, the success rate is very low. In such cases, we don't do IUI. Whereas with IVF, even if the tubes are damaged, IVF can be performed and there is a risk of ectopic, whereas the risk of ectopic is very minimal with IUI patients. And as I told you, for frozen embryo transfer, we were not starting, but we will start soon. Then this is an important point I would like to talk to people. We believe in doing immune testing and immune treatments. This is particularly important in many cases, people who have repeated miscarriages. We don't know whether it is because of the embryo issue, that is the chromosomal abnormality, or combination of immune issues such as antibodies, natural killer cells, and cytokines. These can go and attack the embryos and make the woman reject the embryos. In such cases, we do immune treatment such as intralipid infusion, intravenous immunoglobulin, and of course, blood thinning injections and other things. Blood thinning injections is okay. We also use steroid tablets and this intralipid infusion and IVIG. These are all a kind of immune suppressants. And when somebody is taking this, we give them vitamin C, high dose of vitamin C and calcium tablet to protect them from catching infections. But this COVID-19 is a very new virus and unique one, and we can't say that we will be able to protect you with this vitamin C and calcium. So I will say, look, if anybody has to start treatment, they need it. Please be aware that you have an increased risk, and be careful. That means even if you are going to do it, then delay your treatment, or you should stay at home. Don't expose yourself to anybody else. That's why we are not encouraging people to start with this. Having said that, with those women who had IVF treatment and who are pregnant and who are on immune treatment already, we are continuing them because we can't suddenly stop and it may affect the baby. That's why we are continuing it. But right now we are not starting. But again, it is the choice of the patient. We will give you all the pros and cons. We'll inform you of the risk. And then if you say, look, you understand the risk and you still like to go ahead, then we will do it. We would like you to make an informed decision about it.
Okay, brilliant. Thank you very much for that very informative talk on what we're doing to keep you safe and the rationale for which treatments we're starting with. So now I'd like to move on to slightly more practical points. So in terms of minimizing the risk of infection to patients and staff who attend the clinic, there are a few things that we're going to sort of change and modify in the way that we work. So first of all, we want to try and keep any infection outside of the clinic. So in appointments where we don't physically need to contact the patient, we will try and do them remotely. And as Dr. Venkat said, it's a very new way of working and we're getting used to it. And I think that at this point, everyone is much more used to the idea of webinars and consultations being done remotely. Luckily, technology these days works quite well most of the time, so it's a bit easier to do than before. We're also going to make sure that we pre-screen anyone who attends the clinic. So my colleague Rachel will talk about this in a bit more detail, but we want to basically make sure that as far as we are aware, people who attend the clinic don't currently have an infection. Similarly, we will be checking temperature when anyone actually, patients and staff, visit the clinic each time, just to make sure that you don't have any symptoms of the illness. We will definitely screen all our patients for current infection using the specific COVID-19 PCR test before they actually start ovarian stimulation to make sure they are clear of the infection at that time. And as Dr. Venkat mentioned, we are going to reduce the number of appointments during a treatment cycle. So if, in pre-COVID-19, pre-lockdown days, you might have, if you'd gone through an IVF cycle with us, you may have come to the clinic 6 or 7 times during the stimulation part. But now we're going to reduce that down to about 4 or 5. And it's a couple of appointments less, but it makes quite a big difference in the overall picture. And we're doing this basically to reduce the number of people on site. Because the more people you have on site, the greater your risk. And lastly, I'm afraid this isn't going to be very popular with most people, but we're going to ask that no one brings any partners or visitors to their appointments unless it's strictly necessary. So this is, we do require that you have an escort if you've had any sedations. If you're having egg collection and you're being sedated or you're having some other procedure under sedation, you do need an escort home. So we would like you to bring your partner or friend to that appointment. But otherwise, we are asking that you please do not, because it's simply a numbers game, because if we have everyone bring their partner or friend, it doubles the number of patients or people in the clinic, and it essentially doubles our risk. So we are going to request this change. So that's what we're doing to keep the infection outside of the premises. Now, we do have to come to the clinic, and I listened to a webinar where there was a professor who gave a talk, and he said, the only way to have a completely COVID-free clinic is to keep the clinic closed, which is not practical. So what we're going to do in terms of when you actually attend is we're going to ask that everyone wears personal protective equipment, PPE, and depending on what procedure or what we're doing, it'll be different amounts of PPE that are required for staff. But for patients, we ask that all patients, every single time that you attend the clinic, we ask that you wear a face mask, please. This is very important. You see, a face mask prevents the spread of any infection. So we all have to do our bit in this. And so it's important that every single one of you wears a face mask whenever you come into the building, and you keep it on during your entire attendance at the building. We are putting in screens on the main desks. So again, this reduces the risk of any infection being transmitted, because COVID-19, this illness is transmitted in the droplets that come out in our breath. And so having physical screens obviously prevents any droplets reaching someone else. We have also increased our appointment times. This gives us longer intervals between patients. So again, it reduces the risk of airborne droplets. We've also increased the frequency and thoroughness of our decontamination for all clinical procedures. We have switched to single-use or disposable items. Most of the clinical items we use are single-use anyway, but there's some small changes that we've made, such as disposable cups for beverages. And also, lastly, we've spaced out our chairs and reduced the number of chairs available in all the given areas. And we are strictly limiting the number of people in a given space. So we're trying to maintain social distancing. Now, we work in a grand old house, as many of you know, and we're limited with what we have. So we're going to limit the number of people in a given room and maintain social distancing in line with government guidelines as much as we can. Now I'm going to hand over to Rachel, who's going to talk you through the details of triaging and testing. Thank you.
Thanks, Suvir. The safety of patients and staff is at our utmost priority going forward with this. So every time a patient comes into the clinic, we will triage them with this set of questions. It will become incredibly repetitive for everybody because you will be asked several times by several different members of staff the same questions. But we ask that you answer honestly every time to these questions. If you answer yes to any of these questions, that's fine. What we'll do is we'll take that away, the clinical team will assess that, and then we'll come back to you with how you can proceed. For some people, if you do answer yes to multiples of these questions, we may ask you at that point potentially to not enter the clinic, and that is for both your safety and for our safety. We have developed, as Dr. Venkat was saying, some new pathways and protocols for patients. This is for your safety as well as our safety. This is our new patient pathway, as you can see below. As I was saying earlier, we will be asking the triaging questions. So these questions will be asked after a new consultation prior to anybody coming into the clinic. They'll also be re-asked by reception when you enter. What's really important about this patient pathway is that we need to stick to it. It is incredibly important that we stick to it. So some of you who have previously been patients of ours before have gone through the process and you ring with day 1, ready to come in day 2, day 3. That's not something that we can do moving forward if you haven't been screened. If you've been screened, we will have given you a protocol, everything will be fine. But what you'll need to do going forward is everyone must have a nurse consultation. The nurse consultation must happen 2 weeks prior to treatment. This is so we can give you this set of triage questions that you can answer. You then sign the declaration saying that yes, you've answered truthfully. And then 3 days before treatment, we'll ask you to come to the clinic to have your COVID PCR swabs. These dates are incredibly important, and again, they're for your safety and for our safety. So please don't be disheartened if you call and these steps aren't in place and we ask you to maybe come back in a couple of days' time or reassess the cycle. We're not trying to be a hindrance, it's just so we can maintain the safety of everybody. So once you've signed the declaration and that's a yes, you've had your PCR swab 3 days before you start treatment and that comes back clear, you are fine to proceed through treatment. If your PCR swab comes back as positive, you will at this point be asked, well, you will stop treatment and we can't restart you until you return a negative result. Throughout simulation, you'll be asked this set of questions multiple times. Please continue to answer these truthfully. Again, it's for everybody's safety. A few different changes, as if you are returning patients, you'll know that the nurses operate on the top floor. Going forward, you won't come up to the top floor anymore. We're organising the patient flow throughout the clinic. As Suvir was saying, we can't have a constant flow of people in and out, so we must organise it better. So your process will be, you'll enter the clinic where you'll be met by somebody from reception who'll check your temperature and ask you a series of questions. You will check in at reception, as you normally do. Once you're called to your appointment, you will take the lift. You don't take the stairs, take the lift up to level 1 where the scan room is. You'll have your scan. Then you'll go next door into a separate consulting room on the same level for your blood tests. If you have any medication that you need, we'll bring that down to you and you'll finish your appointment in there. Then you'll go down the stairs to what you may know as Suvir's office next to reception to check out. The reason we do this, again, is just to maintain the cleanliness and the safety of everybody in the building. When you come for your PCR swabs, because we don't know if you're positive or negative at that point, you'll be taken down to recovery. and there'll be a single designated bay in recovery where we'll swab everybody. So no more climbing the stairs for anybody. Carina, I think this is you.
Hi everyone, good evening. I hope you're all doing well. I may have spoken to some of you already, but what I want to say is we understand that lockdown has been difficult. It continues to be a difficult time and we're all adapting to a new normal. And now that we are reopening, we want to ensure your safety as much as possible throughout your fertility journey and treatment. So we have also had to make a few changes. For example, patients must be trained on correct use of PPE prior to entry to the clinic. It's our duty to ensure that when you attend the clinic, we minimise the risk of infection. And so that means the correct use of PPE at all times. When you're in the clinic, for example, face masks, please make sure that they are covering your nose and mouth, and please avoid touching your face as much as possible. All patients will be given information about COVID-19 verbally and in writing. So this will be carried out by the consultant and the nursing team. They will go through the details of the virus and the risks, ensure that you understand everything. Once you've had this discussion, you will then be given the choice as to whether you would like to proceed or postpone treatment. Patient support, availability and counselling, and our staff. We understand that many of you may be anxious and stressed during this time, which is normal. It's a very different world we're living in, and we're here to support you. If you have any questions or any worries, please do come and talk to us. We are here to help you, and we also do have counselling available. Patients must be advised of the financial implications of treatment being cancelled due to COVID-19 infection. So what this means is if you develop any symptoms or if the clinic is forced to stop treatment due to government guidelines, you will be credited for cycles being cancelled and you will be charged for the work done already. So seek support and help and come and talk to us. So the message I want to leave with you all is please do reach out at any point. If you have any questions or any concerns, please feel free to pick up the phone or send us an email, and we'll be very, we'll be very happy to help you in any way we can, even if it's just for a chat or to discuss any concerns you might have. Thank you.
Okay, thank you very much, Carina. So I'd like to wrap this webinar up, at least before we go to the Q&A, with something we're calling the code of conduct. I can't stress the importance of this, and we're going to go through, we've gone through exactly the same thing with all our staff, which is that, we can take all these precautions in terms of who we let in the building and how we screen people, we wear PPE and all of this, but, it's our duty to all also behave sensibly. If you're going to attend a medical practice where there are bodily fluids and there's people around, it's a very different environment to what you've been in recently. Everyone's been at home and there's very few people around and you really haven't been in contact with people. So now you're exposing yourself by coming to the clinic. So it's important that all of us sort of adhere to this. So what we would really like, we'd like a commitment from all our patients and all our staff, which we've already got. And the first point is we want you to think about identifying the risks of COVID-19. So we want you to think about, what are the main sources of risk? So this is mainly from people. That's how this illness is transmitted. So it's busy places, with lots of people. So hospitals, transport hubs, or other areas with, high rates of infection, such as nursing homes. The other place you can get the virus is from objects. So any hard surfaces or objects that have been near other people, it's, as I mentioned earlier, it's droplets and breath that carry this virus. And so be observant, be vigilant of people who might have symptoms. Keep your distance. I know everyone is social distancing, but it's important that you do stay away from anyone who has any possible symptoms. So please, 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 I know we've all said the word safety so many times, but I can't stress this enough. Please take as little risk. You can't take no risk, but please take as little risk as possible. Think of yourself and think of others, because you see, if anyone who comes to the clinic has the illness, that means they're probably going to infect other people. And so it's a commitment from all of you and all our staff to say, we want you to think of everyone. And as Dr. Venkat mentioned, it's not just the adults who come in, it's also the unborn children. So please avoid unnecessary exposure to the risks of infection at home or at work. Please restrict your interactions in line with government guidelines on social distancing and staying at home. In terms of the way we behave, please simplify your lives. Only do what you have to do. So perform only the essential activities and do it at the minimum possible frequency. Again, that reduces your risk, and in turn, that reduces the risk of everyone who comes to the clinic. And please, we're mandating that you do wear PPE in the clinic. We ask that you take sensible precautions elsewhere. Please protect yourself and others. Wear a mask if you can. Wash your hands well and often. And if you're not able to wash your hands, please do use hand sanitizer. I know we've probably all got very dry hands at this point after so much washing and sanitizing, but that's going to be the new normal for the foreseeable future, I'm afraid. And this last point is important. As Rachel said, it's not something, we ask that you're honest and truthful. If you feel that you have any symptoms or you may have been exposed to COVID-19, please tell us. And it's not that we're going to stop or cancel your treatment immediately. You may not have been infected. We'll review the situation, but it's very important that you communicate this to us. And it's your responsibility to do so. If you are, if you're in a household with a lot of people, maybe try and keep your distance as much as you can, because tell them that you're going through fertility treatment, and it's very important that you do try your best to stay infection-free. And maintain and adapt. This is it's a very rapidly evolving situation that we find ourselves in. And you do need to continue to stay aware of the need to protect yourself and others. This isn't going away quickly. It's not, the lockdown isn't going to be released overnight next month or something. It's something that's going to be slowly eased off, and it's only going to do that if we all do our part. We will, as Dr. Venkat mentioned, inform you of changes in the guidance and the clinic's policy. We will do our absolute best to keep you up to date. It can seem sometimes a bit overwhelming because things do change quite quickly, but we will continue to keep you updated. Thank you all for listening. Now we will go over to questions, and we've had a few already. So please feel free to send in any questions, but we'll start going through them. So the first question I have is, does that mean all FETs cannot take place currently? So I'm going to hand this over to Dr. Venkat, if that's okay.
Hello. Yes, that's a good question, because I think I probably gave some confusing information to you. Now we are planning the treatment for the patients who are starting next week and the week after, the first 2 weeks. So we haven't planned to start any FETs because that was not our original plan. However, like I said, things have changed in the last 2 weeks from when we started this plan. And therefore, we have, this COVID-19 virus, it mutates. So we have to mutate along with that. So we have to keep changing the plan. So we will now change, because we want to do treatment for everybody that is possible. We can't say, I won't do it, there is no preference here. But it should be a safe practice. We should not put your health or baby's health at risk. That's why we were hesitating to do. However, now we have changed our views and opinion. And now from next week, we will be planning for the frozen embryo cycles. Therefore, the patients will be able to commence it from the end of June or beginning of July afterwards. Yes, there's no problem.
So yeah, I think that answers the next question, which was, I'm confused about whether or not we're doing frozen embryo transfers. And as Dr. Venkat just said, it's, we're working our way through the list. We're starting with the most urgent cases, and we're not doing them immediately, but the situation is changing, and we will start to do them shortly. The next question I have says, do we need to fill in any forms or undergo the COVID swabs, etc., prior to coming in for an appointment if I'm not undergoing any treatment? I am due to be coming in for a scan only. So no, it's we will triage you because you will be coming in for scans. So the list of questions that you saw on one of the slides, you will be asked all of those, and to make sure that you are as illness-free as we can tell. But you will not need to undergo a swab test for the COVID-19. That's only required if you're going to go through treatment. and you won't need to fill in any declaration forms either. The next question I have is, what would be our next step if we are ready to start an FET? Do we need to arrange a consultation?
Yes, I think that's the right step. We have again the list of patients who were waiting to start frozen embryo transfer when we closed. I think Rachael has got a spreadsheet with the names. We will be informing all the patients now. Or in case you want to call us, if you contact the nurses, they will arrange an appointment for you to have a telephone chat or a video consultation with me to make a plan of your treatment. Because I said that, we have to plan everything beforehand. You can't just phone, I am day one and then I want to start. It's not like that anymore. So I will make a plan of your treatment, and then you will have a video nurse consultation. They will go through more details about the practical issues, and they will book all the appointments. Now you will have all the appointments given to you when we plan the treatment. So they will book all the appointments and the injection teach or whatever you need to do for the frozen embryo cycle. They will arrange all that, and you will sign the consent forms with them. Once you are done that, then your treatment will commence, and that's why we need 2 weeks to plan for it. That's the reason I said that if we start planning now, you will be able to commence in the 3rd week of June.
What about women who might be considering egg freezing? How will you be managing this during this time?
Egg freezing is, again, like similar to IVF because it involves ovarian stimulation. However, the eggs are not fertilized and transferred into the woman. We will freeze them as eggs, and therefore it involves the first stage of the ovarian stimulation. We would like the patient to have the same triage questions and the viral testing. And if they are clear, we can start the stimulation. And we will be careful not to overstimulate you so that you don't end up with hyperstimulation. And we will look after you in such a way that it is a safe stimulation for you or safe treatment for you. And then you will go home without any complications.
The next question says, if you've had pre-treatment blood tests which are valid for 3 months only and technically are no longer valid, do you need to have the blood tests again?
Okay, this is an important question because it's a practical question. If you have to repeat it, first of all, you need to come to the clinic or to the lab. So make time for it, and additional expense again. We had spoken to our regulator about this, our inspector. They said that they are talking of discussing it, but they didn't come back with a definite answer, but they have left it to us. Usually we do the screening test just before starting the treatment. So when we stop the treatments in March, if you have done it in March, it should still be okay. It will be within 3 months. Or if you have done in February, it should still be okay. It is within 3 months. And in some selected cases, you can discuss with the nurses because they will always check and make sure it is valid. And if they are in doubt, by a few days, they will come to the clinician and we will make a decision.
Next question says, is the COVID swab only before ovarian stimulation or also for FET? I'm afraid I'll have to answer this with a non-answer, which is that we are in the process of developing our FET pathways because we've only sort of looked at ovarian stimulation at present. And so, we will come back to you on that one. But by the time we arrange your doctor's consultation, that policy will be in place. So we will be able to answer that question for you at that time. Does this include scratches? So I think you're referring to endometrial scratches. Typically, these are only done for any transfers. And so we wouldn't plan on doing them, except in very rare cases if we're planning to do a fresh transfer. But I'm not aware of any cases where we've planned them as of yet.
Yeah, we are going to, you're right, we will be doing it or talking to patients about the endometrial scratch before the frozen embryo transfer.
Okay, and there's a couple of specific questions that we will come back to you about offline, come back to you individually. I won't sort of do that in the group, if that's okay. There's another question, just to clarify, no FET for another 2 weeks or so. Yes, I mean, as Rachel mentioned, it's not the old sort of protocol where you can call us when you're ready to start and we can start your cycles. For any cycles, you have to sort of start the process at least 2 weeks before you would start the treatment. And at this point, we haven't got to FETs yet, so at least another 2 weeks before we start any of it. But as Dr. Venkat mentioned, if you are thinking of starting any of these treatments, please call us and let us know so that we will add you to our sort of treatment waiting list, and then we can start the process if that's relevant, or if you've already done some of the steps, then we'll make sure that you sort of start at the right time and place in the pathway. Okay, so that sort of concludes all the questions. I really hope that this webinar was useful to all of you, and I would like to thank all of you for your time, and I would also like to thank our panel once again for their time and their input in all of this. There's been a tremendous amount of work that's gone on behind the scenes, and we do hope that we've done the right thing and we're able to protect everyone's health as best as we can. And we look forward to welcoming many of you back to the clinic very shortly. And that leaves it just to thank Ashley and Gavin also for your help in moderating and managing this webinar. We couldn't have done it without you. So thank you all very much, and we hope that everyone has a lovely evening and weekend. Thank you. Goodbye.